Welcome. Today we're going to be talking about something every home health nurse should be concerned about: Medicare denials. The truth is, most denials don't happen because of the care you provide is poor. They happen because the clinical story isn't clear on paper. Even the most skilled nurses can get caught in this. In this video, I'm going to talk to you about how auditors think, why notes get denied, and how to make your documentation defensible and audit-ready. By the end, you'll understand the steps you can take to protect your care, your license, and your agency's revenue. Let's start with the mindset of a Medicare reviewer. These reviewers never see your patients, and they don't know you. All they see are your words. That's why the language you choose is so important. Every note should answer 3 silent questions that every reviewer asks. Was skilled care required? Was the patient homebound? Was ongoing care medically necessary? And if your note doesn't clearly answer these questions, it's vulnerable, no matter how excellent your care was. Understanding this perspective is the first step towards audit-proof documentation. Now let's talk about the most common reasons good nurses get denied. Vague language. Phrases like doing well or tolerated treatment tells auditors nothing. No clinical reasoning. If you don't explain why a skilled nurse was required, the service may look unnecessary. Stable patients. Stability doesn't mean skilled care isn't needed. You must document ongoing assessment and risk monitoring. Copy-paste patterns. Cloning previous notes is a red flag. Every visit must reflect the patient's current condition. Poor interdisciplinary alignment. Conflicting language between nursing, therapy, and other disciplines signals poor coordination. Awareness of these gaps will help you start thinking in audit-ready language immediately. Medicare pays for skilled care, not for tasks. That's a key point. Completing wound dressing, administering medicine, or educating a patient is not enough to justify skilled care unless you explain why a skilled nurse was required. For example, if an aide or family member could have safely performed the same task, your note must explain why the nurse's assessment or judgment was necessary. Skilled care is about clinical reasoning, risk management, and medical necessity, not just completing tasks. That's the difference between a strong note or a denial. Next is homebound status. Another common audit failure. Being homebound doesn't mean a patient never leaves home. It's about the effort required to leave home, the safety concerns, and medical limitations. Your note must show why leaving home is challenging. For example, difficulty with mobility, oxygen dependency, or risk for falls. A generic statement like, patient is homebound, just won't pass. Specific, measurable language protects both the patient and your documentation. Every visit note should tell a complete clinical story. That story should include what you assessed, why it mattered, and what interventions you provided, and how the patient responded, and what risks exist without continued skilled care. Remember, auditors don't connect the dots for you. Your job is to present a clear, defensible story. This is where your note becomes not just documentation, but protection for you, the patient, and the agency. Now let's talk about AI. I want to be clear here. AI does not replace nursing judgment, and it does not create care. What it does is help you organize your clinical thinking and make your notes clear. Used correctly, AI can help translate your observations into Medicare acceptable language, highlight gaps in your documentation, and assist in creating audit-ready narratives. This reduces stress and helps ensure your excellent care is properly documented. Well, I've created an IA prompt pack designed specifically for audit defense, not auto charting. This resource helps you organize your reasoning before you submit notes. It's EMR agnostic, easy to use, and focused on creating clear, defensible documentation. Using this pack is completely optional, but the key takeaway is that structured prompts can help support your thinking and make your notes stronger. Think of it as a safety net, not a replacement for your expertise. Let's summarize. If you take nothing else from this video, remember these 3 points. Good care must be clearly explained in your notes. Skilled need must be obvious. Don't assume the reviewer is going to understand it. And audit-ready charting is about defending your care, not creating extra work. Your documentation should protect you and your patients and your agency. And tools like AI prompts can help you achieve that while keeping your notes accurate, compliant, and defensible. Well, I thank you so much for watching, and remember, every visit note is an opportunity to tell your patient's story clearly and confidently.